there. Oh, it's good to see you. You caught me a little early. Let me just change into my white coat here. So you're back again for the headaches, right? Sorry to hear it. Getting a little better, though? All right. Well, let's take a look at the diet options. I know you wanted to look into that. That sounds good to me. All right. It's always good to see you. You brought your headache diary with you? Perfect. Okay. And you took notes from last time, right? Okay. You have your notebook and your paper again? I think there'll be some good notes for you this time. Okay. All right. Well, as always, because we're meeting here in this secret place, even though I am a real physician, and you can check my license number down there, everything that I say is going to be self-care only, okay? There's going to be nothing that's particular medical advice for diagnosis or treatment of any disease, because you and I have not met in person, right? This is our secret meeting, right? Of course, we can't let them hear. We can't let the man hear our secrets that we're having. Little health secrets just for you. Don't want the other doctors to know. Okay. I have really good resources here for you that I'm excited about. I think... Where did it go? We'll go over it together in just a second. Okay. But first, let's do our exam. Now my brain is going to be stuck on this. Do you ever get like ADHD brain where you get like stuck on something and here it is? Nope, here it is not. This is my other book. This is a survival book. This is tropical medicine. Isn't it lovely? It's upside down, isn't it? Tropical medicine. This is my Special Forces Handbook. There's so many things that we can go through together. There's so much to learn. The human body is an amazing. This is emergency medicine. The human body is just an amazing resource. It's an amazing invention. I really respect it. And we learn new things about it all the time. I wonder what I have done with the little diet book I had prepared for you. I might have to leave the room to go get it. I'll just have you make yourself comfortable. We can put on some gentle white noise. Did my medic take your blood pressure? Perfect. Okay. Any new significant changes since last time? Any unexplained chest pain? Any changes in your vision? Any syncope? Anywhere you faint? Any palpitations? Okay. Any episodes of chest pain that gets worse when you walk but better when you sit down? Okay. And then any new onset right upper quadrant pain, that's pain. So for you, it's going to be on this side, right under here. This is my left, obviously, but on you, it's going to be kind of right under where the breast would be, but a little further down. Okay, any new that? Okay. Or severe pain, like right in the middle. Okay. And then any new changes where you get dizzy, okay? Or you have trouble walking, or you start slurring your speech, anything like that. Okay, good to know, good to know. I wonder what I have done with this book. I know. Here it is. This is the book that I wanted to show you today. I wanted to go over, there's some beautiful, see, this is for clinicians. So this is what we use. Remember, I always try to dig in for you into what physicians would use. Nutrition. Instead of you going to Dr. Google. Dr. Google can be misleading, especially if you don't know how to control or command him. If you don't know what to tell him to look for exactly. Alright, well, let's get started on the exam. Listen to your heart and lungs. We'll look over your headache paper, and then we'll see from there. Okay, alright. So just get comfortable. Okay. Alright. And as always, we listen in 4 spots. And down here. Wonderful. And then, okay, I'm going to listen in the back to listen to your lungs. Take a deep breath for me, in and out. In your nose and out, and in and out, and in and out. Very good. Wonderful. Alrighty. Oh, sure. You want to listen to mine? You're welcome to do so. We've known each other long enough. So what you're going to do is you're going to put these things always face towards the patient. Not like this. Like this. So you're going to put it on like this. I put it on like this, right? So these things are always towards the patient. The stethoscope has two different sections here. This is called the diaphragm, and this is called the bell. Okay? I can also put a little one of these over top of here to make it a pediatric one, and use it as a diaphragm as well. The bell is better for picking up, like, there's certain kind of gallops that the bell is better for picking up, and there's certain kind of whooshing sounds that the diaphragm is better for picking up. You listen with the bell to the carotids, and you should listen with both the diaphragm and the bell to every spot when you're checking, and you just switch it like this. See? Now it's open to the bell. And now it's open to the diaphragm. Yeah, that's how the stethoscope works. And basically each spot you really should listen with both, because there's gallops that you can hear with this that you can't hear with this. Exactly. There's sounds that are more like punchy sounds. So like when in your belly, if I want to hear the sounds of your intestines, I'll listen with this. But if I want to hear if your aorta has something wrong with it, I'll listen with this in your belly. Listen for basically sounds like that might indicate there's an aneurysm or something like that. You can listen to the aorta, and you can also listen to the iliac veins below it. Yeah, I mean those are both part of the cardiovascular exam, really. Yeah, so those are the two sides. You really want to listen? Okay. You're gonna hear demons. There's a lot of bad stuff in my heart. There you go. Alright, and then the 4 spots that I can show you. So, here, let me move a little bit so it's easier for you to see. Okay, so for the 4 spots, so you're gonna listen here. Oh, you got some on your face, my dear. There you go. Is that better? Okay. So for the 4 spots, you're going to listen. I want to do it backwards here because it's the other way around. There's this spot, this spot, this spot down here, kind of on the side, left lower sternum border, and then there's another spot under here. Okay, and I usually ask women to help me out by lifting. But sometimes if it's just a quick check and I don't want to put them through all that, I'll just listen on the side here to try to get the sound of the aorta, or not the aorta, I'm sorry, the mitral valve the same way. So you listen to the pulmonary spot, the aortic spot, you listen to the left lower sternum border, helps you hear the tricuspid, and then this up in here helps you listen to the mitral valve, or over here. You can listen on the side. Okay? Here you go. Is that neat? So basically, each spot helps you to hear different things about the heart. Yep. Well, it's kind of like you're shooting a camera from different angles, but you're listening instead. Exactly. Alright, so as you know, we only do the heart exam for headaches, to just make sure there's no red flags, anything going on. I don't think that your headaches have a cardiovascular component based on what we discussed last time, but it's always good to check. And then the answers you gave me are kind of negative. They indicate not likely to have a cardiovascular component to that headache. Okay. Any new, and we already said no new dizziness, no new unusual weakness on one side, anything like that. Okay, excellent. Very, very good. So, let's get back into the rest of the headache stuff. I'll just do a quick head exam too, since so no new trauma, right? You haven't hit your head lately? Excellent. Okay, and then here in the back of your neck, nothing, no new pain there. You have a little bit of stiffness here in the back. That's definitely gonna be related. And then there's a lot of tension here in your occipital area. Okay. Maybe we'll do a visit where we do OMT. That might be good. Okay. Alright. And then just real quick, can you follow my fingers? Perfect. With your eyes? Nice. Very good. Okay. Can you hear this on both sides equally? Perfect. Okay, great. And does this feel the same when I touch your face on both sides? Good. Stick out your tongue, move it back side to side for me. Like that. Okay, open your mouth and say ah. Can you say ah into this light over here? Yep. Perfect. Very good. Okay. Yeah, so that's 3, 4, 6, 5, 12, 7, 8, because I can already see you smiling and moving your face around, and then 9 and 10, and then can I get you to shrug your shoulders? Yeah, it's a speed version of what we did last time. Like I said, like you can do a lot of checking in the moment and see if something is an emergency or what is going on. Exactly. Oh, you're wanting to learn some of this stuff because of your work, because it's so dangerous. We'll have to talk about that. That secret agent job you got. Alright. Well, you have your pencil and paper? Let me see your headache chart, the headache diary you did. Perfect. Okay. While I'm looking over this, will you do me a favor and raise your hands like this? Alright, and put them behind you like that. Behind you like this. Okay. Can you squeeze my fingers really hard? These two? You're going to squeeze around like that. Perfect. And then lift your knees. Alright, and then kick out your feet. Perfect. Okay, very good. Alright, let's look at this headache diary you brought me. Oh, it got all crumpled up. Are you having some adventures? Okay. I see. Perfect. Okay. Alright, I do think that food is going to make a difference. So let's take a look and see what the evidence is that we have available to us, okay? That's this lovely thing. It is very good. I love this sound. Nutrition. Guide for clinicians. Right. I think that I had the headache section marked for you because I knew you were coming in and I wanted to show you the lovely, because there's a whole section on headaches. It's usually more directed towards migraines, but it can be for a lot of different things. Here we go. 565. Page 565. The There's actually even diets for if you have an ear infection, things that can help you. And the thing I love about this book is it cites all the studies. Obviously, I don't read anything to recommend to my patients, really, that doesn't cite all its studies. So you can see what the study was and if it was any good. So just to show you, this is the section on migraines. And it talks about them as a neurological disorder, it talks about the aura. Yep. And remember we talked about last time, the aura isn't like a new age thing. It's like, right before the headache, you might have, well, like this one, they explain it really nicely here, hopefully. A state characterized by unusual visual or other sensory phenomena. So I've had it where you get purple, like a purple haze beforehand, or people might see like gray dots, things like that. Usually it's visual or auditory, not usually like something like smell, but people will get it. So for migraines, about 60% of cases it's mostly one side, but it can be global too, or frontal as well. So usually explosive onset is not a migraine. Usually that's something else. So, and remember we talked about last time the difference between a migraine and cluster headache. A migraine being something that's maybe unilateral, throbbing, multiple headaches, moderate to severe intensity, lasting hours to days, nausea, vomiting, photophobia or phonophobia. Remember last time I asked you, would you rather punch a wall when you have the headache, or do you want to hide in a dark room? And that the dark room answer is more like migraines. It gets worse with activity. Any kind of normal stimuli suddenly hurts you for no reason. Rhinorrhea or congestion is not really common. Those are actually more common with a cluster headache, but it can happen with a migraine too. Migraines are usually familial. So anyway, it goes through a bunch of the treatment stuff that we already went through. Remember we talked about the aspirin, the acetaminophen with caffeine. We talked about a couple different things for your migraine. One thing we didn't talk about was intranasal lidocaine. That's not really common in my practice. I don't do that usually, but that's also a possibility. So anyway, we talked about those things yesterday. We talked about prophylactic therapies. Remember, like using propranolol, using a calcium channel blocker, an antidepressant, something like that. So now we can talk about these things. There's 2 medicinal botanicals that it goes through here that are quite lovely. So riboflavin, before we talk about the 2 possible herbals, we can talk about just the pure diet stuff. Riboflavin is one of your vitamins, right? And it might be helpful to increase that in your diet. Some people have found significant reductions in headache frequency with daily pharmacological doses of riboflavin or vitamin B2. 400 milligrams. So let's look at the studies. So it's making that claim. Let's look at the studies. So the studies are 45 and 46. So the studies are going to be these ones. High-dose riboflavin treatments is efficacious in migraine prophylaxis, an open study in tertiary care from the European Journal of Neurology. It's a good journal. Effectiveness of high-dose riboflavin in migraine prophylaxis from Neurology. So those are 2 studies that were done, and so you can look those up by those names if you have questions. So that's something you can try, is you can try taking riboflavin 400 milligrams every day. So another supplement that might be helpful is magnesium. Remember we talked about that last time. Magnesium deficiency is common in patients with a menstruation migraine. So that's a good one. Remember we talked about that. So as you see, a lot of these things that I just have in my head, you can also get because these are the things that we study. So I just had that memorized, but that's something you can look up in these kind of books. This is very good. Obviously, you're not going to be a doctor by having the same doctor resources, that I have. Part of interpreting the resources that are available to you comes with training. It comes with having seen many patients. I've seen a couple thousand patients, and so forth. So by now I have seen a couple thousand. By the time you're much older, you've seen, many thousands of patient encounters. Once you've, I'm not a very old physician, and I've already seen a couple thousand patients, so you can imagine that kind of experience is really what builds up into your knowledge and being able to interpret some of this stuff. So what I'm saying is, don't think that you're a doctor because you have the resources, but do look at the resources, bring them to your clinician, and work together. So you can work together. You can say, hey doc, I'm on this and this medication. I was thinking about trying riboflavin for my migraines. Would that interact with any of the medications that I have? Yeah, exactly. And what you can do is you can bring them the studies. You can be like, these are the 2 studies that I found. And, you know, I would like to have them. No study is perfect, but it's good to have some studies available to make your decisions. So we talked about magnesium. I usually do 500 milligrams a day is what I recommend, a starting dose. They don't have a starting dose here. Supplemental fatty acids. The rationale for use of essential fatty acids originated in their purported anti-inflammatory and platelet stabilizing effects. However, promising early reports were followed by a negative report suggesting that a strong placebo effect may influence research findings. So what does that mean? That means that fatty acids, the evidence doesn't seem to be that good for them. Okay? So there's other things that taking a fatty acid may help. The lady who ran or founded the Fibromyalgia Institute, I can't remember her name, Dr. Gwyneth or something like that. I have her book here too. I have so many books. She recommends it for fibromyalgia patients, and there's a couple, recommendations for fatty acids for prevention of like memory disorders, things like that. But for as far as migraines, there isn't that good evidence for it. Okay. So, caffeine withdrawal obviously can cause headaches. So taking caffeine daily, some people use caffeine, a very strong caffeine, to try to stop their migraines. Remember I said that you could take caffeine at the beginning with the Excedrin and acetaminophen together? But if you take caffeine every day, you may build up a tolerance, and so that may make your migraines worse. So, and then heart health promoting diets. Individuals with frequent migraines appear to be at higher risk for coronary artery disease compared to people without migraines. In the Women's Health Study, which included nearly 28,000 individuals, those with a history of migraine had more than twice the risk of MI, myocardial infarction, heart attack, compared with women who had no migraine history. Similarly, the Physicians' Health Study of over 20,000 individuals found that those with a history of migraine had more than 40% greater risk for MI compared to other people. So what does that mean? That means a heart-healthy diet might make a big difference and might be important. Your migraines may be your body telling you need to protect your heart. So for a heart-healthy diet, and I want you to write this down, okay? For a heart-healthy diet, the Mediterranean diet is the best, as the one with the most evidence right now. There's all kinds of different diets. You hear about keto for weight loss. You hear about all these different things. The Mediterranean diet is the one that has the research behind it right now. Yep. The Mediterranean diet. And so you can look that up and look up the components of that and start to incorporate that into your life. There's so many good and delicious things. It's not like the problem with these fad diets is people think about it like, oh, I'm going to go on a diet, I'm going to achieve the results I want, and then I'm going to go back to eating whatever I want. It's more like you start adding good things to your life that are like medicine. There's an old Chinese proverb, let your food be your medicine, right? And so instead of, yeah, exactly, you're exactly right. Instead of letting that, thinking of a diet as, oh, there's things I can't eat, think about the things you can eat, think about the things you need to add, the different vegetables or herbs or teas, elixirs that are going to heal your body. Think about it like magic, and that's much better. Everything is better if you think about it like magic. That's how I do with my pediatric patients. I see no reason for the adults to not feel the same way. Life is better with magic in it. Okay? So a heart-healthy diet. So look that up. Look up the Mediterranean diet. Alright. Let's talk about the 2 herbs. So the 2 herbs are parasites or butterbur and feverfew. Okay, and there's some evidence and information about both of them. Before you take any kind of herb, you need to look at the back of the bottle. I don't have a bottle here to show you. You need to look at the back of the bottle, and you need to make sure that there is a little seal on it that says that it's been tested, and that they say is in the bottle is actually in the bottle. So a seal that says that it's been independently tested and verified is very important, because they can sell you whatever they want in those pill bottles. They're not regulated. The benefit of them not being regulated is that we can get these supplements onto the market faster without waiting, and then therefore we don't have to be suffering. We can just start taking them. The problem with it not being regulated, these supplements, is that they can, with these vitamins and things, they can sometimes put whatever they want in it, and it's like the Old West. And, you could be getting thyroid medication by accident, or you could be getting flour. So it could work or could not work, right? So you need to make sure that what they say you're getting is actually what you're getting. Exactly. Oh, really? You don't say. Oh my goodness. Wow. That's weird, man. Yeah. Well, so yeah, butterbur and feverfew were the two I wanted to talk about. So butterbur, you can see here it's the Parasites hybridus root. Yep. I love this resource because it's got a lot of things in it that I wasn't normally trained on in medical school, like supplements and things. So it's kind of some additional stuff. So for the butterbur, in a double-blind randomized clinical trial, butterbur reduced headache frequency by nearly half compared with placebo. That's really good. This effect was achieved with 25 milligrams twice a day. BID is how we say it. In a larger study, a second trial with more patients found that only a higher dose, 75 milligrams, resulted in a statistically significant reduction in migraine frequency. Okay, so there's several studies on this, and I can read you the study names so that you can look them up. There are so many, 22, 24, 25. Tons and tons and tons of studies on this one. Well, not tons, but good. So the one study was in the Journal of Neurology by Lipton, R.B., Goebel, Einhaupel, Wilkes, and Mousecope. So you can look that up. Parasites hybridus root butterbur is an effective preventative treatment for migraine, Neurology 2004. And 24 is by Diener, Ralphs, and Danish, and that was in the Journal of European Neurology. Also 2004, the first placebo-controlled trial of a special butterbur extract for the prevention of migraine, reanalysis of efficacy criteria. And then the other study was in the Journal of Headache. It was by Danish, again, I guess he likes to write about headaches, Rittinghausen, safety of a patented special butterbur root extract for migraine prevention. And obviously you want to be careful with the groups that are patenting ones. So, the mechanism by which this botanical may reduce migraine attacks has not been established, but it may include spasmolytic and anti-leukotriene effects and an effect on calcium channels. What does that mean? So it means that how this herb may be working is that it's going into the little blood vessels in the brain and basically helping them not to be all squeezing all tight and hurting your brain. So it may be affecting the calcium channels. They're calcium channel blocking, right? So instead of them squeezing, they can relax. So far, butterbur has a good safety record. Belching is its most common side effect. That's not the worst thing. I'd rather be a gross burp monster than be in pain, curled up in the fetal position in the dark. Yeah, it depends on the person. The other herb is feverfew. It's an herb with anti-inflammatory properties, but research studies have yielded mixed verdicts as to its efficacy for migraines. Some clinical trials have suggested efficacy of the native herb or its extracts in preventing migraines. Others have yielded inconclusive results, perhaps due to the variations in preparations being tested. That means that they might have been using a different dose and a different, mix of the root or the leaf. And obviously that's not specific enough to give you good results. There was a recent randomized double-blinded multi-center parallel group study, wow, that's a really good study, that found that feverfew extract at 6.25 milligrams 3 times a day did decrease migraine attacks by 40% compared with a 27% reduction for placebo. And that has some really good studies with it too. So 27 and 28, those are the studies by Pittler in the Cochrane Database Systematic Review, feverfew for preventing migraine, and Diener and a bunch of other people in Cephalalgia 2005. And it looks like a really great study. Randomized double-blind multi-center parallel placebo group blah 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 study. That's really good. Basically what that means is they were very, very, very careful to try to avoid bias by having it so the researchers didn't know which people got which pill, the placebo or the real thing, and the patients didn't know either, and they had an extra group to compare it with. They made sure that the groups were very similar. They checked across many centers so that you wouldn't be biased by, race or economic breakdown in a certain area, hopefully. They did a really good job, so that sounds really good. So what does this mean? I think that if it were me, I would try Butterbur first because it's got the most evidence behind it, and then I would try Feverfew. And I might actually try those before some of the pharmacologicals that I suggested in the last video. Depending on what other medications you were on, whether or not you could get a pure, a good bottle. And you can always check with consumer safety reports. Consumer Lab, you can Google them, and you can always check the company. You can also check with the Better Business Bureau and see if any claims have been made against the company. Yeah, exactly. So, but the easiest way to do it when you're shopping, if you don't want to do all that, is just look at the back. Does it have an independent label? At the minimum, that's the minimum check you can do. And if it does, you can be like, okay, I kind of trust this. And if it doesn't, move on to the other, there's so many brands out there. Yep. But yeah, that's the dosing. And, which one would you start? Which dose would you start at with the Butterbur? Well, because there was a study that found 25 milligrams to be efficacious, I would start with 25 milligrams twice a day, and I would bump it up until it started working. And of course, your headache diary is really important for this, right? Yeah, exactly, because you need to chart. You can't just feel whether or not it's working. You need to chart how many headaches you're having a week. And after 2 weeks of the Butterbur, is it getting better? No, I'm going to increase it. Is it getting better? No, I'm going to increase it. That's how we do with our medications. So that's what I would do if I put someone on Topamax, which is one of my first line preventatives because it helps with weight loss as well. It also has some emotional effects for decreasing anger. Yeah. Because it can have side effects, and that is always concerning. So, well, specifically, oh yes, no, you're absolutely right. Oh, I'm glad you've already looked it up. Yeah. Well, yeah. Yeah, let's get back into it. So, one thing you can try to find your trigger, your specific migraine trigger, is called an elimination diet. And with an elimination diet, you can actually decrease your migraines 25 to 50%. So what you do is, first you're going to eliminate all foods that could be possible triggers, and then you're going to slowly add them back until you find out which one triggers you. So to do that, you're going to start on a diet. Now you need to write this down. Okay, you're going to start on a diet that includes brown rice, cooked or dried fruits like cherries, cranberries, pears, or prunes. No citrus fruits, okay? So no oranges, things like that. You got it, okay. Cooked green, yellow, and orange vegetables. So that's going to be like artichokes, asparagus, broccoli, chard, those kind of things. Yeah, lettuce, spinach, string beans. Anything that's yellow or green, sweet potato, squash, tapioca. Taro is purple, but you can still have it, okay? So it's going to be those cooked, plain or carbonated water, and condiments, salt, maple syrup, and vanilla extract. And that's it. Avoid caffeine or wean yourself off caffeine, okay, to start this diet. And this is going to be your pure elimination diet. These are the things that you're going to eat only. Okay, for a couple weeks, you're going to see how many migraines you have on that. Okay, and then the next couple weeks, you're going to start adding foods back. You're going to add foods back one at a time that are important to you. Okay, and each one you add back, you test and see, hey, is this giving me more migraines? And you count how many migraines you had that week. Yep. And so the food diary helps you. This is like an amazing technique. This is probably the most useful thing that I've mentioned. People who have heart problems usually find benefit by eating those omega-3 fatty acids we talked about and decreasing other fats, right? So that's something, and what's interesting about this elimination diet, oh honey, you've got a little thing there again. There we go. What's good about this elimination diet is you really are reducing, you're basically going on a heart healthy diet, but a little more strict, and then you're slowly building stuff up. And you're kind of letting your body tell you what foods you should and shouldn't be eating. So you're getting a twofold benefit. One, you're decreasing your migraines, and two, you might actually be protecting your heart. No, I absolutely think you should check it out. That's why we do the heart exam at the beginning. The head and the heart are connected. I know, isn't that poetic? All the movies all want you to have them be separate and be fighting each other and follow your heart. And of course, no one wants you to follow your head anymore. I don't know why that seems stupid. They actually need to work together, both in medicine and in the philosophical realm. Yeah, please try those. I think that'll be good. Well, I'm going to have a cup of tea. Would you like to join me? Absolutely. Okay, that sounds good. Yeah, I have some tea right here. This is a lovely mug, isn't it? Well, and it's lovely outside. Sure, we can talk. We are friends after all. I'm not just your doctor anymore now that you're doing the secret agent things. We'll be working together much more closely. So this is the Bengal spice from Celestial Seasonings. Remember we talked about tea quality. You know, this is neat. They don't have strings or tags because, so they're able to save 3.5 million pounds of waste from entering landfills every year. Isn't that cool? Because these are natural fibers, so they biodegrade. Isn't that neat? So that's neat. That's good on this company. Good for them. Obviously from Boulder, Colorado. I love Colorado. It's such an interesting state. I love the things they do. Bengal spice. So this is not a real tea. Because remember we talked last time, teas are from, the tea plant. So these are things, this includes, like cinnamon and vanilla. This is a chai. It's a chai tea. So they have cinnamon, roasted chicory, roasted carob, natural spice, and vanilla flavors with other natural flavors, ginger, cardamom, black pepper, cloves, and nutmeg. So this is a chai. This is an herbal, not a real tea. So I brew it the way I brew a black tea. Oh, that's right. You should go back to my other video about brewing tea. So we brew it like a black tea, boiling. Same way we would. Because it's a chai, a big cup like this is okay. Because it's pretty strong. Then we let it steep for about 4 minutes. I'm going to do it like that, like I would do for a black tea, because it's a stronger, herb. Treat peppermint like that too. Although, I guess in my brain, part of me wants to treat peppermint the way I treat a green tea, right? Because a green tea you don't brew that long. You do maybe 175 degrees Fahrenheit, so not too hot. And 3 to 4 minutes, yes. A white tea you would do less. So 4 to 6, 3 to 4 for a white tea. It actually lasts 3 minutes for a white tea at a much lower temperature. I'm still learning. About 160. 160. So the thing about white tea is it's always very fancy. Yeah, I'm a fifth of the way through my becoming a tea sommelier. I got 100% of my last blind cupping, actually. Yeah, it was fantastic. I was most proud of the fact that I correctly identified the Kimun black tea versus the Assam black tea. Basically, I'm learning to where I can taste what part of the world it comes from. Isn't that cool? Yeah, it's pretty neat. Yeah. So how is the new job? Yeah, we can share since we've been living together, you know, in the same secret agent commune. We have all the same germs by now. Oh, that's right. I'm sorry, that must have been rough. That's pretty awful. No wonder you're having headaches. But you recovered a bunch of the artifacts. That's neat. Well, why don't we take them to my friend? Did you meet her? She's, you know, a lot of us in the agency, we just call her the space woman. You have met her on your way back from the zombie thing? That's right. Well, she is an expert at fixing things. We can ask her to fix the things. Yeah. I have a portal actually in my office. Yeah, I can send you to her. Yeah, that's no problem. That sounds good. Isn't this lovely? I love chai tea. It's like my favorite, even though it's not real tea, so. The tea plant is called Camellia syrinensis. I don't pronounce it right. You have to go back to the tea time we had together. Yeah, that sounds lovely. That sounds good. Well, hey there, Butter Pumpkin Sunshine. Welcome back to space. It's been a while since we took that test, remember? That's right. Remember I tested you with those different cards? That's right. How did you do? I don't remember exactly. That's right. You had trouble identifying the different nebulas. I remember that. Don't they smell so good, these cards? I'm a collector, so I collect things from all times. All times and areas of the universe. Well, you know, I am happier than a frog in a bog to see you. I told you last time I don't have no accent. We don't have regional boundaries the way you do in your time. Our regional boundaries are different. We're mostly concerned with discrimination against the frog people from Gorgon 7. Humans, we figured our stuff out mostly since then. Oh, I know you don't believe it, but people from your time have always been kind of cynical. Yep. You miss a lot of the universe the way you think. So you have something for me, the good doctor told me. Told me you had something for me, right? Brought me something to fix. Let me see. Oh, that's a beautiful little artifact there. What happened? Oh, and you got this gem. This'll be an easy fix. That chain just needs some tweaking. This is a little more complicated. Oh my dear, look at that. That's beautiful. This is handmade, isn't it? It's medieval style. You got this while you were time traveling? Yeah, I think I can fix it. There's a piece missing. You're missing a piece, but I can get it mostly back together. Absolutely. Well, so now you've joined the agency, right? You realize we span time and space. That's neat. That we're an alliance from all over, all different times. All different peoples. I'm not sure my glue is going to cooperate with me today. But I'm certainly glad to try. We'll see. Come on, you. I know. So don't mind me if I start to mutter while I'm working. I might mutter and whisper to myself. I might mutter a little bit. Some kind of, might be unintelligible whispering. Looks like spider silk, don't it? I love spiders. They're extinct by my time because of the fear your people have of them. It's unfortunate. They're one of my favorite legendary creatures. Them and unicorns. I was told your people also made the unicorns extinct. No, that's not true. Oh, well, good. There's some lovely things in your time. Some very interesting medical science comes from your time. I think that we'll be able to get that set. We'll just let that super glue be for a little bit. I think we can fix it. So is the agency doing museum things now? Oh, I see. I respect that. I respect that. Nice. Alright, we'll let that sit and see what we can do about it. What a lovely little goblet. You could drink some good stuff out of there. I love it. Nice. Alright, I'll put this to the side. I think it should stay. You still got that crack, but that gives it character, like the old Greek amphoras. I'm kind of like, that's right, Indiana Jones, I heard of him. Kind of like that, except I take things that people bring back and I fix them from all times. So I'm kind of like a museum curator. I call myself the curator, but everyone calls me the space woman. The curator hasn't stuck. Oh yeah, our expedition's going really well here, up on this here planet. Well, and you can see the atmosphere's breathable now. Since last time you came. It wasn't then. Alright, let's set this to the side. I think we can let it heal. Just let it heal. Alright, next thing. Let's see what you got. Let me take a look at that. Where'd the little gemstone go that you had? Where'd you put it? Oh, I see. This is beautiful. This is also handmade, isn't it? I love that. Look at that. Look how it changes with the light. Matches me. Don't worry, I won't keep it. But it is beautiful, isn't it? It looks like my eye. Alright. Enough goofing around. I know you've got places to be. So I'll just fix the chain here for you. Shouldn't be that hard. You know what I might not even need? Might not even need the tweezers. Let's see. Well, I might have spoken too soon. Let's get the tweezers up in here. I know. Well, you're absolutely right. What I'm going to do is I'm going to open this up. Stick that in. And then I'm going to close bit of a knot in it here. Oh, I know. What I want to do is get it on the most far end. You're right, this would be better with that stuff. You can do it if you want. No. Okay. Alrighty, and we almost have it in the little... There we go. Now we just gotta close this back up, so that don't come loose no more. You know what I could do is I could put a little drop of glue right there. No. I think that's what I'm gonna do. So it don't come loose again, you see? Right there. Just so it don't come loose again. Well, yeah, this is different than the one in your time. This is made of spider silk, actually. Oh, that was a little bit of a big drop. Well, we call it spider silk, but it's not spider silk. We use a material we call spider silk for building all kinds of things. Spiders are legendary in our time. Arachnophobia is unheard of. This little thing got tied in a knot here. See if we can't untie it. Untie it. Untie this little knot. Untie this little knot. Alright. We're making some progress here. You see that? Making some good progress here. There we go. Look at that. Now we just gotta unhook this. We'll be through it in no time. I won't just let this fall to the end there. There we go. Perfect. There you go, all set. Well, I know sometimes the agency gives the agents some of the treasures they find, or they'll incorporate they'll either ask a favor from us in the future or from your fairies in the past to try to incorporate some of it with either magic or technology, depending on what time you're in. You call it different stuff. As you know, magic is just technology you don't understand yet. All science is magic. So sometimes they'll take these beautiful little things and incorporate them with special abilities for y'all. So, especially something that's handmade, that's got heart into it, they like to honor that. The agency is different from other agencies you might have worked with. Alright, let's put that to the side to heal. Heal, heal, heal. Alright, next item. Next item. Oh my. Oh, I see. You wore this on your fashion mission. Oh, I see. Why'd you bring it to me to get fixed? It's not... Oh, you want me to incorporate some of what I got into it. I see, I see. Alright, well this top part isn't broken, so that's good. Oh no, you didn't wear it. Someone else wore it? Oh, I see. Ah, I see where it's broken now. Okay, okay, okay. Oh, what a pity. Okay, so we gotta make sure that the ends match. when something breaks this easy, it's either very cheap or very old, right? I see. It's kind of like you're missing a wire here, to tell you the truth. Kind of like you're missing a wire. I'm not quite sure how to... I guess if I put this in here... Don't be in no hurry. You're good. You're good. I'm not in no hurry. Okay. Yeah, I don't quite see where these pieces fit together. I think you might be missing a piece. Trying to see how the weave works on these pieces. Looks like this piece is supposed to be. Looks like the wires just kind of snapped. I guess what I could do is I could take this piece, and I guess I could unhook it, and then hook it back around this piece. That's what I could do. Oh yeah, she told me you might fall asleep during this. That's okay. If you fall asleep, I'll just ship you back with all this stuff intact. Don't worry. I might take a payment or two out of your pockets, but it won't be that bad. Alright, so I'm gonna bend this over, I think. Gotta bend it over harder so it doesn't unbend. There we go. That'll do. It's good enough for government work. Oh, and that's why it broke. Because government work ain't that good. Well, that's why, as you know, the agency doesn't work for the government. Oh, you didn't know that? Oh, that's right. They don't let the newbies know a lot. Honey, there's something on your face right here. You got a little sprite there on your face there. There we go. Okay. I just can't concentrate with your face all messed up like that. That was all. I don't know how I'm supposed to... I guess if I curve it underneath. What a bummer. I'm gonna try curving it underneath here. Gonna try just sticking it up in there. Here, this little piece should be able to bend around this piece here. This is difficult. I know some people get really angry when working on this kind of thing. Oh yeah, your doctor, she wouldn't be able to. She likes results right away. That kind of personality tends to not like this kind of thing. Alright, well, it sticks now. I think what I'll do is I'll add some glue. Glue to everything, right? No, we don't worship spiders. We just respect them. We worship the one who made them. Oh, I know. In your time, people are very uncomfortable talking about their own beliefs, but here we're very open, and we have open dialogue. And it's okay. We might feel strongly about it, but we'll live. You said there was another break. Oh, you say here. Okay, I see what you're talking about. I see. I know I heard in your time there's some people who want to ban discussion of belief systems so y'all can't share your ideas with each other. That sounds ridiculous. To me, anyway. Yeah, we speak pretty firm here. We don't mince words. Yesterday, one of the polynomial tribe told me I was insane. Didn't offend me and hurt my feelings. He was telling me how he felt about my understanding of the fourth dimension, and we have very strong disagreements on that matter. Well, of course it matters. How you understand math and dimensions affect how you understand the universe, and even things like the divine or the nature of the eternal. All those things matter. In a sense, everything matters, and in another sense, nothing matters. There you go. That's fixed. Alright, my dear, we'll leave that to the side to heal. Let's make sure that part that I glued didn't get tangled up. This is an easily tangled little bit of machinery here. Where is it? The part that I just did. I can't tell. I think there's no reason to be afraid of disagreements. That's what I think. I think when we start fearing disagreements, we start closing our minds. And then we miss out on what could be. My buddy from the polynomial tribe, we had a drink afterwards. Wasn't a problem. Was not a problem. We disagree. It's okay. Something else on your face. Hold on. I know, just don't mind me. It's just I can't concentrate with this stuff on your face. There we go. I don't know what it is, but it's some kind of weird energy thing from your time. And I want it off. It's distracting me. I know you probably can't see it. There we go. Alright. Now, what else have you brought me? Oh, that's neat. Oh, that's just for me? To hold my stuff up? Sounds good. I'll keep it. I'll use it for my tea shop. Oh, this is beautiful. Oh, I'm sorry about this. It's from Japan, you said? Oh, I see. And this thing used to fit here. Oh, well, I'll get that fixed up right away. You said right here it used to fit? Alright, the trick is just going to be making sure I put it on the right way, huh? I'm confused already. Where's the break? On this side. Oh, there's more pieces. This piece comes off the middle, you say? Oh, I see the break for that one. I don't see the break. Oh, here we go. Here's the break for this one. Alright, one break at a time. Well, let's do this break first because it's going to be the easiest. Okay. We'll get that break up in there. This one's going to be gotta be a little gentle and careful with it. Man, I wish I could have been there for your mission. You must have been to all kinds of different countries. Don't worry, I'm putting a little excess now so that it sticks now. We can always wipe off the excess later. The main thing is getting it to fit back where it was. That's going to be a challenge to keep that hold in there while the other one holds. Here's what we'll do. I'll hold on to it here. And then you'll help me get another piece. Another little dab right there. I don't know that this is gonna work with this. You might actually have to solder this. Yeah, I think you have to solder it. I'm so sorry. But we'll do our best to see. You leave it with me and I'll solder it, and you can come pick it up another day. Alright, let's leave this to heal, and we'll kind of see how it works out. Let me move this. And we'll leave it to heal right here. I don't think it's gonna work like this though, to tell you the truth. I think we're gonna need to have it. Sorry about the loud noise. Maybe if I can leave it sitting right here. That is a beautiful piece. I'm so sorry about that. Yep, so that one you're gonna have to leave with me a little bit. I'm gonna have to solder it. I'm gonna have to actually melt down the metal, put it together. I don't know what I've done with my soldering iron, but I'm gonna have to do that. Sorry. Oh, the jade piece is easy. You said this was jade from Korea? Oh, honey, this is missing a piece. You brought me the pieces of 2 different rings. These aren't from the same ring, honey. These you'll have to do next time too. What you're gonna have to do is find the other pieces of the rings, because these aren't the same ring. These 2 pieces don't go together. So you have to find those, okay? But otherwise, we got most of your stuff fixed, okay? Any questions? Alright, well that sounds good. I will see you next time. What I'm going to do is I'm just going to have you go to sleep. Go to sleep, go in a little trance, and I'll send you back the portal the way you came. It's always good to see you, pumpkin spice butter cookie. It really is. It really is good to see you. Well, sometime you can help with our colonization efforts. We're creating a new utopia up in here. Alright, good night, little one. Sleep well. I'm sure you know how to find me. If you don't know how to find me, you ask your doctor to help you.